Many groups have followed the social distancing guidance and have canceled large events, but as you know, 30,000 Sounders fans were at a match in Seattle this Sunday. Other countries like Spain and Portugal are already moving to have soccer matches played in empty stadiums and broadcast. Referencing those numbers that you just cited about the doubling, shouldn't a policy like that also be considered at this time?
We are considering policies in that regard, and we're doing what we should do in consideration. We're looking at the most recent epidemiological research available, and I mean recent. We just found a new study yesterday afternoon pertinent to this issue. We are talking to the communities and leaders and public health experts, so we are considering those measures. I would not be shocked if we have some more news on that in the next few days.
Governor, on the, can you just clarify that for a nursing home resident, one of the provisions in your proclamation says a resident can choose to discharge from a facility at any time. Is that referring to a resident that is not diagnosed with COVID-19, or could a resident who's been diagnosed with the virus still discharge at any time?
I'm Cheryl Strange, the Secretary for the Department of Social and Health Services. A resident can discharge at any time. There are a couple ways they can do that. They can receive a doctor's order to discharge. Some individuals may choose to discharge what we call against medical advice, in which they are going out against the doctor's desire. Again, our Home and Community Services division within DSHS has a transition team. We discharge patients and transition patients all the time. So they are free to do that, and we stand ready to support them with additional placement options. The challenge, of course, is finding additional placement options right now, but we are working on that.
Apply immediately to the residents of Life Care in any nursing home in the state if they wish to remove their parent, if the parent wants to leave today as we speak. Could that be done?
The answer's complex in the sense that we're in the middle of this incident and trying to manage it. There are a lot of guidelines. You know, as Governor said, we are following the science. We have the CDC. We have the Centers for Medicare and Medicaid issuing almost daily guidance. The Department of Health is issuing new guidance following the governor's executive proclamation here. So at this point, we are on a case-by-case basis. There are overriding requirements with all these things.
Let me add something to Jerry's question here for a minute. So if there is a person that creates a risk to other folks, either because they've tested positive or maybe even because they've been in contact, the state does have the authority to insist on isolation of those people if they do go to a different site. So far, we have not been required to make any orders. So far, virtually everyone who we've made requests has complied with that request. So I would anticipate that if there is someone, certainly if they're positive with COVID-19 in the facility and they'd like to go somewhere else, they're going to be advised to, wherever that is, to be a place where they can be isolated or quarantined. And you can anticipate that if they're not cooperative with that we do have the authority to require that. Like I said, Washingtonians have been extremely cooperative. Virtually everyone, almost everyone, has really complied with the request. So I'm not concerned about that. That's going to be taken care of.
Governor,
yeah.
Given the numbers that you just laid out in terms of the potential spread here, how can you afford to wait even one more day for mandatory policies around social distancing to try to not contain this anymore, but mitigate for it?
Well, we're doing everything in real time as rapidly as possible to make good decisions. And you don't want to make decisions where you haven't thought about the consequences. Shutting down any social activity has profound consequences in people's lives. And you have to understand those, and you have to see if there's ways to reduce them or ameliorate that. That's the work we're doing right now. And it is done with a sense of urgency that we feel, given these losses. We feel it so profoundly to lose 22 of our citizens. We know the stakes, but we need to understand the science fully, and we also need to have some communication with leaders in the community. I have extraordinary emergency authority in this regard. But if it's going to be followed, if it's going to be effective, we have to have some relationship with local communities and leadership, and that's why we're having conversations about this right now on this subject.
Just to help us look around the corner, is it likely that the local areas that are most affected would actually impose these requirements, or that they would come from the state? Would they be geographically limited or statewide? Would schools be included, not included?
So, as I said, I will not be shocked if these questions are all answered in very short order, but we have not made final decisions, and it could consider all of the things you just listed. Those are the kind of things that we're thinking through right now. There are multiple legal jurisdictions that do have authority to impose restrictions. The governor being first, or the most geographically dispersed. Local health officials also have authorities. Cities even have some authorities. So there are multiple authorities that could act. Obviously, I think that using the governor's authority may be the best from a statewide perspective. And I can just assure you we're considering those things right now.
Governor, you've used the number 64,000. There might be that many cases in 7 to 8 weeks. How many deaths do you anticipate?
So the mortality rate of this virus, there's not a precise number available to us, and probably won't be for years, if ever, because to figure out the mortality rate, you have to assume how many people had the virus, and sometimes that's hard to figure out because we don't test everyone. The information we have is that the World Health Organization and their experts have assigned a mortality rate of, I think it's 3.4% of the people who have the virus. Now, if in fact that is the mortality rate, and you have, you know, over 64,000 people infected, you've got maybe 1,900 fatalities just that week. Just that week. And the next week, it doubles that. So this is a significant number of people who are potentially at risk if this continues to go. If the number is closer to 1% mortality rate, then you get numbers in the 600 range just that week. And whatever those numbers are, obviously those numbers are high enough that we need as a state to be bold on some of our actions at the right moment when we've been able to assess all the science. So I don't think we have the luxury of arguing whether it's 1% or 3%. It's too high at either one, and that level of fatalities is unacceptable. So that's where we're moving here.
It's a bit jarring, though, to, you know, we see like the band Pearl Jam has canceled its tour, and they live in Seattle. It's a bit jarring, some would say, just that people individually are having to make these decisions as opposed to government.
As I said, the government is going to make the right decision at the right time on the right science, and after talking to the right people to assure that whatever decisions are made actually can be implemented. And that's what we're doing today. Don't be surprised if we're back here in a day. George, you have a question?
Governor, I'm just curious.
I'll get you in just a second.
I have a question also. I'm very strange about options for, you mentioned finding placements for people for isolation or quarantine. What sort of options are you looking at here?
Again, Cheryl Strange, Secretary for the Department of Social and Health Services. Joe, we don't have any new miracle options. You know, we have a range of services. We serve about 125,000 individuals in our long-term care program. About 55,000 of those are served in the facilities that the governor is talking about today, our nursing homes and our ALs, our assisted living facilities. We've got another double that being seen and provided services in their own home with individual providers, agency providers in the long-term care system. So those are the options that we continue to have. We've got nursing homes, adult family homes, individual providers providing care. So our goal is to try to minimize the placement of people who do not need to be in a hospital level of care into those services as well. That's an area we're working on in transition. We have some people in community hospital beds, as you know, that we're working to get out, they are taking many of those slots as well. But we're trying to keep up here.
Governor, you had mentioned the 64,000 figure. Given the fact that if life care runs its course and the people there are dealt with, is there the potential that the numbers of deaths may not reflect the 64,000 and may not go up dramatically as a mathematician might project? And again, also, how is your health and have you been tested?
No, I haven't had the test. I feel great because I'm surrounded by a lot of people who are working hard on this, and I'm inspired by what I see around me. So I feel good about our working mission here. Look, all of the numbers that I've just shared with you are estimates, and there are wide ranges on the estimates. There's a wide range. It may be 2,000, it may be 500 as to the number of people infected, but I know that it is too many today, and that it is one that causes grave concern, because the one thing we do know is that there is a fairly predictable rate of spread, which is anywhere from every 5 or 8 days, these epidemics double of this particular epidemic. So whether it's 500 today or whether it's 1,500 or 2,000 today, that just goes to a very large number very, very quickly. So what happens in mid-May if this is not slowed in some fashion? It could be shorter than 60,000 by tens of thousands, or it could be a lot larger than 60,000 by tens of thousands. That's the closest range, kind of midpoint of what I have been able to ascertain talking to the epidemiologists. So you may have a discussion of, 5 epidemiologists, one who says, no, it'll only be 30,000, and another will say, no, it'll be 100,000 in mid-May. But that is not an argument worth having. It's just either one of those numbers indicates we need to move here. So that's the information we're making. I'm going to take 2 more questions. Yeah,
Governor,
maybe one more.
If you had a wish list of things that could either be done, or federal government, or National Guard, I mean, what would you ask for? What does the state need to potentially keep these numbers from growing as high as potentially they could?
Well, what we need, and I'm sorry if you've heard this before, but what we need is the most important people in the state of Washington, frankly, are not governors or senators. They're every individual in their family. Because the most powerful force to restrain this epidemic are the individual decisions of 7 million Washingtonians. And if I was going to ask for one thing, it's for everyone to get up in the morning and focus on their family and what they're going to do, but also think about what can I do to reduce the risk of this. And those things are the single most powerful weapon we have against this epidemic. And so far, I'm pretty pleased of what Washingtons are showing. They're teleworking in the droves. They largely are, to my knowledge, not going to work when they're sick. There's a lot of bumping of elbows going on instead of shaking of hands. Those are the big weapons against this epidemic. If I was going to pick a second thing, it would be a surge capacity for our medical system. If these numbers get anywhere close to what I've just talked about, we are going to have real challenges in our hospitals in being able to deal with very, very sick people. There are limitations on personnel that we're working through, and there's some concerns. We're trying to maximize the availability of ventilators, which is very important to people with severe respiratory problems. We have a plan where we have identified where those assets can be, but there's going to have to be some changes on how we run the system to maximize the efficiency of the assets, personnel and equipment that we do have. But I do believe we're well suited. The state now, for some period of time, has had a working plan to find and to implement those medical facilities and personnel. So with that, I want to thank you well. Take care.
The other speakers can stay for a few moments if
Yeah.
there's
Any questions?
Needs to go talk to the business.
Thank you. Be well.
If there's other questions for our other participants here.
I do have a question about the long-term care facilities when we're talking about the testing. I know at the Life Center in Kirkland, employees have not been tested yet, and the care center said it's because they requested the test, but they have not received them. Is that true? Has that not been a priority? Do we know when they're going to get those tests?
Again, Cheryl Strange for the Secretary for the Department of Social and Health Services. The Department of Health, Secretary Weisman, is in charge of the expanding the testing. He's probably better able to speak to that. But we do know that the clients, the residents there have been tested. Obtaining testing equipment is a challenge we are grappling with now, and trying to get as many test kits as is possible for life care as well as the other long-term care facilities. So stay tuned.
Time frame on when employees.
I do not have a time frame. I would need to check in with Secretary Weisman on that.
Can you describe those challenges to getting more test kits?
I believe it is the test kits, getting qualified testers. I know that the governor worked with the FDA and a variety of other federal agencies to certify and get more people, more businesses able to do the testing. I can't comment on where we are with that, other than I know that the Department of Health can do those tests and the University of Washington. But again, I'll defer to Secretary Weisman. I'm sorry he's not here.
The Homeland Security Department, do you have an estimate at this point of how many people might currently qualify for those expanded unemployment benefits for being in isolation and quarantine?
Thank you so much for that. Actually, I want to point people, on our website, we're going to have this grid that helps people navigate what situation you're in and what is the benefit that's most appropriate for you to utilize. First and foremost is using your paid sick leave. That gives you 100% of your wage, and it's something that is an employer-sponsored element. You can see a lot of green check marks on paid sick leave, first and foremost. That's the first choice that you'd want to have. Unemployment insurance, I would think of it more as a last resort, and a majority of workers who are quarantined will be able to avail themselves of this benefit in this instance, given the emergency rules that we've expanded. I don't have specific numbers on that, but I can say that a majority of workers will be able to avail themselves of that if needed and in those circumstances. Excuse me, sorry, Susie Levine, Commissioner for the Employment Security Department. My apologies.
And related to paid family leave is also part of the equation potentially, correct?
So in paid family and medical leave, that is for those who are seriously ill. The waiting week still applies. So for some individuals,
on that, is there a concern that that will increase even more now that potentially people who are dealing with COVID-19 might be applying to the program?
so the question was whether this will increase the high demand that we have for paid family and medical leave. And right now we are seeing it stay relatively level. We're tracking those numbers very closely. Because it is for only those who are seriously ill or caring for a seriously ill family member, we do not anticipate that that is going to increase the demand substantially for that. It is, however, available for those. That said, again, there is a 1 week waiting week period for individuals to avail themselves of it. So if you're ill for a week, not many people are going to take advantage of it. So
10-week waiting period is now down to 1 week.
sorry, to be clear, a waiting week period is the period in which you are not able to receive those benefits. The 10-week period that we had announced a couple of weeks ago is the processing time for applications.
Time.
It is still relevant for those applications that are coming in. We're actually down to 9 weeks for those applications that are coming in starting last week. We are setting people's expectations that it could take up to 9 weeks for processing time for those. And our mitigation efforts on that front are taking hold. We've had dozens of new employees start and working on that effort to work that high demand, and they are having an effective approach to it, and we are reducing that on a regular basis in terms of the expected processing time.
On the numbers, to clarify, you don't have any numbers yet of any individual workers in the state of Washington who are taking advantage as a result of this?
So in terms...
Second, I didn't think I say frankly, state workers as well. There was a mention of state workers impacted in self-isolation. Do we have any numbers on how many state workers have been diagnosed with the virus and are self-isolated?
So I will defer that to Franklin in a moment. In terms of the numbers of people who might have filed for paid family and medical leave who are listing COVID-19, again, when an individual uses paid family and medical leave, they do have to have a medical certificate, or their family member does, for whom they are caring. And we are actually looking at that information now to determine whether we have received those or not, whether people have filed for paid family and medical leave and applied for it given COVID-19. We do not have that information currently. And in terms of unemployment insurance, just for your information, we are tracking those numbers on a daily basis to look at any increases in utilization of unemployment insurance, as well as employers using something called shared work that allows them to reduce their employee staff hours and have partial wage replacement for those reduced hours for their employees, or employers using what's called standby, which allows them to shut down or reduce their staff and allow them to keep those individuals attached without them having to search for a job. So I will now defer to Franklin for the second half of your question.
Good morning, my name is Franklin Plaistow. I'm the Assistant Director for State Human Resources. To your question, we do not have a number right now of employees who are officially in self-quarantine or diagnosed COVID-19 positive. So we don't have those numbers right now. As we have this expansion of a situation where employees may be in a self-quarantine situation, again, our primary objective is there'll be a telework option, working very closely with our employees to see what they could do remotely while they're in a healthy state, able to work, but not able to be in the workplace due to some self-quarantine obligations under the CDC guidelines. So we may have a better sense of that as we go along, but right now they would be reflected in kind of our normal leave usage.
Is there any state, do you know of any, you may not know the number, but has any state worker, to your knowledge, been diagnosed with the virus in any state agency?
Not to my knowledge, but I want to just be very clear, that's to my knowledge right now.
Okay, last question?
Question for Ms. Levine. Someone was laid off last week and they were hoping to get paid this week, and they go through the new channels here, the existing channels. I guess what I'm getting at is how long can they expect to get that fund that they would have gotten from their employer? Is there a delay? You know, a realistic scenario, if someone is that one paycheck away from being homeless or something, will the state be able to fill that gap as quickly as the employer would have, or how long can people expect to have to wait for some of these benefits?
So Susie Levine, the Commissioner for the Employment Security Department. This time I got it. So if somebody has gone on to unemployment insurance, they can file right away if they've been laid off and for cause, not for cause, that they have been laid off, and that process is still in place, and that's a 26-week period in which they can utilize that benefit, assuming eligibility. That has not changed at all in this process. With the expansion of the emergency rules, what it means is that more individuals are able to avail themselves of this benefit if needed. But I will re-emphasize this point. The first choice for those individuals quarantined or isolated or who are ill and needing to take time for themselves, we don't want there to be any disincentive for people to stay home if they need to. So the first choice is paid sick leave. What we are providing, because it is partial wage replacement, is a last resort. And it is a last resort available to a majority of employees across the state, and we've been able to expand it and add flexibility to our unemployment insurance system with these emergency rules.